Christmas, Gmail. Oh, look at that. We're seeing Frank and Sita today. They're down there at the coffee shop, over there. Yeah, can you see them? There we go. Frank comes from New York and Sita comes from DAVAO. Would you like a Christmas tree today? We're listening to Mariah Carey. I've heard Mr. Bublé today, and I've heard George Michael. White Christmas, I gave you my heart. Yeah. So we just had lunch with the grumpiest woman I've ever met in my life. Yeah. Christmas decorations for the outside of your house, inside of your house, Christmas trees, Christmas presents. HIP, or there's HMO, and there's HMI, and then there is PPO. So everything is becoming a little bit convoluted and a bit more confusing. So I can't find anybody that does PPO here, and it's a specific physical policy that's detailed for you and detailed specifically for you. It's more expensive than HMO and more expensive than HMI, definitely a lot more expensive. However, it covers your personal condition. Yeah, so if you've got a specific condition that you need to be covered, PPO is what you need to get. However, it's only applicable at the moment in Manila, and it's part of the top 5 in Manila, but it only come out in August 2023. That's what I'm being told and what I'm reading about. So the big 3 at the moment here are PhilHealth, which is underneath PNHIP. There is also HMO or HMI. Now, the last 2 you get a card for. PhilHealth, you make the payments, they'll give you a registration card, and then they'll give you an account number card that you claim for. Now, when you go into a hospital here and you're looking for medical, if you take out one of the HMOs or HMIs and it's urgent, your policy will be activated earlier if it's urgent to turn around and deal with the problem. If it's not urgent, you will end up having the 7-day to 30-day cooling off period. Now, if you're in the 60s, there are only 3 cards, as I've turned around and told you. You apply for those cards online, and one of them doesn't take any information from you. It just applies, takes the 13,000. Another one goes into more details about what your medical conditions are, what your medical history is, and they keep a record of it. The other one is you just pay and you claim for a certain amount of benefits. Okay, now the big thing about it all, and this is all of them, if you're turned around and you're taken into a public hospital, you can use PhilHealth, all of it. A public hospital, you're not allowed to use HMO or HMI, but make sure you check with your insurance policy or the health medical organisation what and where and who your policy is linked to. One is linked to a network, which is HMO. One insurance is an insurance against your medical condition, and you need to find out whether you can use it in private or public hospitals. Some, and in the States you have Medicare, in the UK you have Aviva and other medical insurance companies. What they tend to do here is you pay up front, and when you go home you claim back against your medical insurance in the country you come from. Great if you're going home. If you're not going home, you can't turn around and claim. Now, earlier I turned around and said to you, I'll turn around and tell you what I do. Now, I don't do PhilHealth. Now, I don't know whether that's right and I don't know whether that's wrong. But when Annie was working and she was making 15 to 1600 peso a month contributions to PhilHealth, when she went to the hospital she got 800 peso back for 2 weeks stay. For me, that benefit doesn't add up. So I turned around and said to Annie, we're not going there. Me personally, I looked at HMO, Easy Care, Phil Care, all these other cards. They cover you for consultation, dental, doctors, hospitalisation, all of this stuff they cover you for, and you've got to pay for all of them independently. And when you go to use them, if you're under the age of 60, they work. If you're over the age of 60, they don't honour them. So I'm over 60. All these cards don't work for me. It's only the 3 I mentioned, so 13,000. Now, Primax only covers me for a certain amount of conditions. Okay, one of those conditions is Section Z within the medical policy here in the Philippines, because they all use the PhilHealth medical policy and what is covered as their base. So PhilHealth publish this, HMO look at that, cherry pick the bits, put that card there, make a charge. HMI turn around and say that's missing, that's missing, that's missing, I need to pay that, that's what you pay for that. So yeah, that's card 1, that's card 2. So I'm like, I've got to do it every year. Okay, I've got to apply every year to each of those cards. I've got to pay cash or card to those medical institutions, and then I get a cooling off period. So I use a credit card. I can walk into any hospital here in the Philippines and they're going to turn around and ask me, like they do everybody, for a 50% down payment if you're going to be hospitalised. So you have to pay 50% up front. So you need an operation, 50% up front. That 50% is normally the price of the surgeon. Surgeon prices here are about 70 to 100,000 peso to do an operation. Then you've got to pay for your anaesthetic, then you've got to pay for 3-day hospital care, then you've got to pay for your medication, then you've got to pay for your food, and then they turn around and let you go. So add up and ask all the questions before you go down this route as a senior, because for me, I've got a credit card, and that credit card will get me into hospital and it will get me out of hospital. Because there's one thing, there's a lovely word in most of the contracts, and I say most because I've not been in all the hospitals, but in all the hospitals I looked at, there is a terminology, one word that starts with the contract: confinement. Now confinement is not a hospitalisation. Confinement is an outpatient. Confinement means they are confining you in a room until you make full payment. It's a lovely word, and you'll hear a lot of it, that hospitals turn around and say you're not leaving until you paid the bill. Well, you've already paid 50% of the bill. You have to settle your full account before they let you go home. So it's not like other countries where you can go home and then you can just make the payments. Here you don't get out, and they'll put a security guard and check on you, and people turn around and say it doesn't happen, it doesn't happen. Well, I know 3 people that have turned around and I've had to go down and settle their bills to get them out of hospital. Annie was one of them. Annie was one of them. I went to the public hospital back in August with Priem, Annie's brother, who's got a thyroid, okay, and over here at DAVAO Premier Doctors, he went in on Tuesday, he could be operated on a Friday. It would have cost about 175,000 peso. He didn't want to do that because he didn't want to be a burden on me. So we went down to SPMC, the public hospital. He's still waiting. Still waiting. His case has been assigned a doctor, but that doctor hasn't got any spaces in his calendar or his diary to do the operation at the private hospital, at the public hospital. And I'm just giving you the 4 options you've got here, guys. My option is number 5, and I take a credit card because I can afford to pay that credit card and get rid of it once I come out of hospital. I move money into my credit card account. I don't want to be sitting in a room waiting for somebody to come and pay the bill if I've got a heart problem, or I've got a brain problem, or I've got a whatever problem I got. The other option I've got is that I can go and buy a ticket for an aeroplane at £1,000 or 70,000 peso with Singapore Airlines and fly back to the UK and check myself into a hospital, yeah, and use my NHS payments because my hospitalisation in the UK is free. But here, where I want to live, when you get older, you get more things going wrong with you and you have to deal with it. But anyway, health. There's the 4 options. Fill health, pay for it, do 10 years and then be moved if you're over 60 into lifetime membership. Number 2, HMO, which supports your Phil Health, or HMI, which also supports HMO and HMI, or the new one, which is PPO. And I don't know too much about it apart from what I've said today. I went down to Phil Health today and I couldn't find anything. They didn't know anything about it at all. Or get a credit card and use the credit card to pay for all your operation or your medical fees. That means you can get in, get the work done and go home and be with your family and friends. Anyway, like, share, subscribe. It's 27 days to Christmas. Have a great one. Take care, guys.